Hi, my name is Robin, and I'm a registered dental hygienist at Aesthetic and Implant Dentistry. Any dental office will recommend that you switch your toothbrush out just about every 3 months. If you're using an electric toothbrush with a removable head, you'll take the head off, throw it away, put a new head on. Anytime you're sick, have a cold, have the flu, had COVID, had a stomach virus, throw that toothbrush away, throw the head away, and get a new toothbrush. The bristles shouldn't even start to do the little flare thing. You gotta get rid of the head before that happens. When your toothbrush looks like that, it is not effective at all. My favorite toothbrush that I typically recommend to my patients is the Sonicare toothbrush. It is, in my opinion, the best toothbrush that you can buy. I see the best results when I send somebody home with a Sonicare electric toothbrush with instructions on how to use it properly, and they come back in 6 months. I typically see really good improvement in their home care. So, Sonicare toothbrush, change the head every 3 months. If you're just really cannot get into using an electric toothbrush, which some people have like a sensory issue with that, then just any soft bristled brush. The bristles bend. So if you're using a hard brush, the bristles don't flex and you'll only be really brushing like the high spots, like the rounded spots of your teeth. So soft bristles at the gum line, perfect.